There are many skin problems with aging. Those who are immobilized or medically fragile are at higher risk for developing fungal infections as well as pressure ulcers, which are both major threats to wellness. Common skin problems with aging include xerosis, which is extremely dry, cracked, and itchy skin, pruritus, which is itchy skin, seborrheic keratosis, which is benign growth that appears mainly on the trunk, face, neck, scalp, and occurs in single or multiple lesions. These can be removed by a dermatologist. Herpes zoster or shingles is a viral infection. It is frequently seen in the elderly and caused by latent varicella zoster virus. Patients who have had chickenpox in the past often develop shingles as an adult or elderly patient. Cancer of the skin, including melanoma and non-melanoma, is the most common of all cancers. Cancers, most are curable except melanoma, which accounts for 5% of all cancers and greatest risk for death. Prevention includes sunscreen, quitting smoking, limiting amount of exposure in the sun, and then frequent regular screenings. Common skin conditions of physically ill or hospitalized patients include pressure ulcers as well as fungal infections. A pressure ulcer is an injury to the skin or underlying tissue resulting from pressure or in a combination with a shear, usually over a bony prominence. Fungal infections are infections of candidiasis or yeast. Pressure ulcers, usually our intervention is to prevent the advancement of the pressure ulcer. Tissue becomes infected when it is moist or the amount of friction, and then also due to age. Fungal infections are present at any age. However, an infection can occur depending on the environment. So it usually develops in an obese, malnourished, a patient who's receiving antibiotics or corticosteroid therapy, and also patients with diabetes are at an increased risk for developing fungal infections. Treatment would include prevention, which is keeping the skin clean and dry. Common foot problems. Many foot problems occur due to poor fitting of shoes, wear and tear, and then misuse of the feet. Foot health and function may reflect systemic disease or give early clues to physical illness. Corns and calluses are bone growth or compacted skin, and it's usually due to ill-fitting shoes or stress on the foot. Bunions are deformities, usually occur due to long standing, and it's the squeezing together of the first and second toes. Treatment would include custom-made shoes, corticosteroids, inflammatory pain meds, and then also surgery. Hammer toes are permanently flexed or paw-like appearance of the toes. It's due to muscle imbalance and pressure, also caused by poor fitting shoes, and is seen often with bunions. And then fungal infections are common due to the aging foot and also increase with age. Nail fungus is also a common fungus amongst the elderly, and it is characterized by degeneration of the nail plate, as seen by change in color of the nail, brittleness, thickness, and when it involves the nail, it becomes very difficult to be healed due to the circulation to the nail. Tinea pedis is similar to Candida infection, and it is a problem developed in your foot, actually in between your toes. In order to keep it from spreading, we also need to make sure that we keep feet clean and dry. And then toenail care is also another important detail in elderly foot care.